and very welcome to all of you. And this is our day of satisfaction and pleasure, as well as our gratitude to Dr. Naima to be with us for a few minutes here.
Yeah.
And it's a great pleasure for us, and as well as our brilliant mentor, Dr. Rashid, also with us. I think most of you know us and oriented with us. So for a while we are waiting for Dr. Naima. I hope she will find better with us. It's my humble introduction. Myself, Dr. Amos Mangani, usually leading the DOAMS as chief instructor. But today is not my day, and I think today is not actually day of Dr. Rashidul Islam as well. So today is Dr. Naima's day, and it is our privilege to congratulate her for her brilliant and the historic victory in the PACES. All of you know that she scored 100%. So without going in depth more, may I request Dr. Naima to take a floor and introduce yourself, please. This is time for you, please, Dr. Naima.
Thank you so much, Dr. Osman Ghani, sir, for inviting me in this session. And I'm really pleased to talk a little bit about myself here. So at first, I'd like to introduce myself. I'm Dr. Naima Tasneem. I passed MBBS from Ibrahim Medical College in January 2015. And after that, I completed my MRCP Part 1 in 2017. I died 2 and also completed my MRCP Part 2 in died 1 2018. And after that, actually, I tried to get a seat in India since 2019. But unfortunately, I didn't get any seat during that time in India. So I had to apply in UK for PACES and most probably many of you already knew that because of only lack of one mark in communication skill, I failed during that time. And after that, I reapplied again in UK. But unfortunately, just before 1 week of my exam, the exam was cancelled because of COVID. And after that, I had to wait for long 3 years to get another seat. And excuse me.
No worry. Take your time, please.
Okay. And interestingly, this time also I got the seat from the waiting list just 2 months before the exam. So actually, the whole journey of PACES was not that much easy for me because I have a daughter who is only 2.5 years old. And because of the COVID situation, I didn't go to outside, and there was a lack of there was a very gap in my study and clinical practice. So it was really difficult for me to start the PACES again in full swing, as well as it was frustrating as well because I didn't get the seat during that time. But Alhamdulillah, finally I got the seat and I started to prepare myself. But actually I couldn't get that much time to get prepared. But because of my first preparation, it helped me a lot in this situation. So I just went for the exam on 24th February. So I was quite happy after giving the exam. But actually, I didn't expect that I will get this marks. Actually, I didn't ever imagine about it. But Alhamdulillah, my all hard works paid off, and now today I am here having a score of 172 out of 172. So you can say this is a short of a long story of mine.
Thank you, Dr. Naima, for a brilliant introduction. I hope we will be with you a few minutes, and our beloved colleagues are waiting to interact with you. So
Okay.
it's your very humble presence or very cordial presence delighting us. I hope that our colleagues are waiting to talk to you, and it's my privilege also actually to be introduced with you. And I know that you were much attached with our brilliant mentor, Dr. Rashid, before. Though we are working with these PACES and others, and it is our pleasure also that we have already our previous colleagues, those who pass PACES, they become mentors also running now in this country and elsewhere. So
Yes, yes.
I hope that you will be telling your story in the last exam you attended, in short though, with your convenient time. But for my beloved colleagues who attended here now, maybe participants will be more and more. You will just raise your hand first for good conduct of the program, and then you will throw the question. I think Dr. Naima Tasneem, sorry, Dr. Naima Tasneem will be very happy to answer your question, because her experience is the best experience for your preparation till now today, because no one more than 100%. It is only the 100%, the end of the scoring system. So she got it.
Yeah.
We are very happy. We are very happy.
Thank you
So,
so much.
Dr. Naima, may I request you just have your have some critical experience in your station in the last diets, what you attended in very short. I think our doctor will be asking you the questions later. Before that, can you
Okay.
finish this thing within few minutes? I think already
Yeah.
hand raises. I hope that many hands will be raising, and everybody keep your hand raising so that you can be in a queue to get your question through to our Dr. Naima today. Please, Dr. Naima.
Okay, actually, I started my exam with station 3. So in cardiology, I had mitral regurgitation. It was the prompt was a lady came with breathlessness to examine the cardiology system. So when I entered and I examined the lady, so it was a clear-cut systolic murmur with a radiation to the axilla, but the murmur was also present up to the left second intercostal space. So some of the candidates were a bit confused about mitral regurgitation along with aortic stenosis, but I was quite sure that there was no radiation to the neck and there was no murmur in the right second intercostal space as well. So I was very much sticked to the MR and the examiner, but in differential diagnosis, I also mentioned about VSD, but somehow the examiner was not that much happy with the differentials of VSD. So,
Okay. Okay, yeah.
sorry, excuse me. I have a very bad cold, so
We are praying for you,
excuse
Dr.
me
Naima. No
for
worry. Take your
that.
time and have a cup of
Okay.
tea or coffee with you. No problem.
No
Okay.
worries.
Okay.
Okay, so actually, he asked me, do you think it's a case of VSD? So I was very clear during that time that no, it is not a case of VSD. But as I had got a systolic murmur throughout the left part of the chest, so I would like to exclude VSD as well. So he told me that if it is not a case of VSD, it's better not to tell VSD. Otherwise, I will ask you questions about VSD and I will not get the time to ask the questions what I would like to ask. So it was his approach. So I was quite during that time. Then he asked me about the reason of breathlessness in this patient. So I answered, and after that, the questions were about investigation in details as well as the treatment plan. So this was my cardiology station. Then I moved to the neurology station. So the patient came with difficulties in walking. So examine the lower limb of the patient. So it was my prompt. So when I examined the patient, I got a spastic paraparesis with sensation intact. The patient was 46 years old. So I told first MND, then cervical myelopathy, and then bilateral stroke. So the examiner asked me, why did you put MND first? So I said that because the sensation was intact. So the examiner asked me, if I tell you that the upper limb examination is completely normal, so would you like to reconsider your diagnosis? So I told her that yes, in that case, I would like to put acute myelopathy first. So next question was, where is the lesion? So then I just answered, it is in the lumbar spine. Then how will you investigate it and how will you manage this patient? So end of this station. So there was no other problems in this station. Then I moved to the station 4 and it was really shocked for me because I actually didn't practice this station never before. So it was a telephone consultation. So the
Fantastic,
prompt.
Dr. Naima. Really is very excellent and exceptional one. Telephone consultation. Let's enjoy and hear from you, please. Please. I know
Okay, yeah.
because when I was mentoring for the MRCGP, I know it about. Anyway, please carry on.
Okay. So actually, it was totally new for me, and during that time, only within 5 minutes, is what it was really difficult to think actually what I should say or what I shouldn't. So I just prepared a bit that I would like to say this, and what was the point. So let me first tell you that what was the prompt. The prompt was 82 years old lady, diabetic, who got a telephone consultation, but they didn't get the call. Relatives was very so I'm extremely sorry. Please excuse me.
Okay,
So
won't worry, doctor,
that
please. Yeah, please
so
carry
the
on.
daughter was very angry during that time, but the secretary told me that our consultant tried to give her a call 3 times, but he didn't get the call. So he marked her as a didn't attend. So it was my whole scenario. So when I entered the station, there was a Tamil woman, and I just asked her, "Are you the daughter of this?" And she started to say that I would like to complain. I would like to complain. You guys are telling that you did call to my mother, but we didn't get any phone call from you guys. And my mother had some hearing issues, and also when he repeated the same 1 and 2 paragraphs again and again. So from her conversation, what I got that he just wanted to complain, and she just want a face-to-face consultation. So at first I tried to convince her that we tried to call her mother, but somehow because of her hearing issue, she didn't receive the call. So but as he raised the issue, definitely I will talk with my consultant, as well as I will investigate this matter, and after that I will be in a better position to say exactly what happened. Then she wanted to complain. Then I told her that definitely I would like to guide you. So I just told her that I would like to guide you to the pulse. Then she asked how many days it will take. It said that you will get the feedback within 28 days. Then she was very angry again. Then 28 days, then it is a very long time. I want to complain again. So I told her that actually it is the duration of time, but I will tell them about your condition. Then she told that she wants face-to-face consultation because her mother had some hearing issues. Then I told her that I'd like to talk with your consultant. Then I can tell you that exactly what we can do. And I will also try to rearrange another consultation within the available schedule. So more or less, this was the conversation within 12 minutes, more or less. Then once she asked me, then how would you like to contact us? Then I told her that I'm going to give you our hospital contact number, or if you want, then you can give your contact number as well. And if there were some issues with the hearing problems, then we can give your mother some hearing aid, and also you can attend your mother during the telephone consultation. So more or less, this was our conversation. And then the examiner part was, mainly the examiner raised the issue that the patient wants face-to-face consultation. What do you want to do? Then I told him that actually I want to talk with the consultation. Then he just stopped me and he asked me, the consultant say, face-to-face consultation is not possible. Now convince your patient. Then I answered the examiner about that. As the patient's mother was well during that time, and if she will come back, she will come to the hospital, there is a chance that she will get some cross infection. So it's better for her not to come in the hospital and take the telephone consultation. And if she develop any kind of complications of diabetes, then definitely we are going to have a face-to-face consultation. And I think the examiner was very happy about my answer, and she nodded his head continuously and was smiling. So I was a bit sure that this patient didn't go that much bad. So then the question was about autonomy, beneficence, non-malfeasance, and justice. So it was overall my station 4. Though this is the first time I practiced, I actually did this station 4 in the exam hall. I didn't do it any time before. So that
Amazing,
was my
amazing,
station 4. And
amazing. Right,
then
right.
I moved to station 5. Station 5, first prompt was 50 years old gentleman came with unable to close the eyes. So I was quite sure it might be seventh nerve palsy. So I was prepared during like that. Then when I asked about the complaints, then he told me that he was coming back from his village in a bus, and suddenly he had some earache, and followed by he was unable to close his eyes. At the same time, his family members noticing that there was some deviation of the angle of the mouth. So I tried to cover all the questions of seventh nerve palsy, as well as I'd like to exclude some other ICSOL, like any, whether there was any CP angle tumor present or not. So everything was actually negative, and I actually examined all the cranial nerves from 2, 3, 4, 5, 6, 7, 8, and 9, 10. And also I examined the ear and also the mouth very carefully. And at last I asked the examiner that I would like to examine the fundoscope as well. And I actually asked very carefully about the driving, but he didn't drive, so that was not an issue. But patient was diabetic, so I also asked about all the diabetes complications, like whether there was any peripheral neuropathy present or not, any diabetic retinopathy, any history of stroke, MI. So I tried to cover all the questions of diabetes as well, and also the drug history, family history, any history of trauma. So I tried to cover all these things. Then the concern was when I told the surrogate that I'd like to examine, I'd like to start the steroid medication. So their main concern was about the steroid medication, that there were lots of side effects of steroid medication. So I don't want to start the steroid medication. So I just assured him that we are going to give it for a short period of time. So it will not cause that much harm. And also if it will cause any harm, then we can counter it with some other medication. So more or less, the surrogate and examiner was happy, but unfortunately, there was some problems with communication with the surrogate during the visual field examination. So I actually missed one question about the sensation of the tongue. So during the crossing, the examiner asked me, "Did you ask about the sensation of the tongue or taste?" I said that no, but I should. Then examiner asked why, because then I told him that because the amplitude height of the tongue is supplied by 7.5%, I should ask this question, but I actually forgot. But the examiner was quite nice, so he said that it's totally okay. Then he asked about the investigation and treatment, and for how long I have to give the steroid medication, in which dose. So more or less, this was my station first BCC one, and the second one was a 70 years old gentleman came with hypopigmented patch. So it was actually vitiligo, a spot diagnosis. But I just asked all other autoimmune diseases like celiac, Addison's, pernicious, type 1 diabetes, and all. But all other autoimmune diseases were negative. It was only a case of vitiligo. Then I asked about all the sensation and also photosensitivity and all other questions, and also examined more or less everything. Like at first the rash, then anemia. I asked the examiner to check the postural drop, then mouth, and also lymph nodes, chest. Also the sensation of the rash, just to exclude leprosy as well. So the crossing was, what is the diagnosis? I said vitiligo. Then the examiner asked about the differentials. Then I told them pityriasis versicolor, chemical, blah, blah. And when I said about leprosy, then the examiner asked, okay, how would you like to differentiate it from leprosy? Then I answered. And then the question was investigation and treatment. So more or less, this was my second BCC. And then I moved to station 1. Station 1 respiratory case was a patient came with breathlessness. Please examine the patient. So actually, it was a case of COPD, a typical COPD. There were partially breathing, excessive use of intercostal respiratory muscles, intercostal indrawing, and also vesicular prolonged expiration crackles. So the question was different findings, differentials, and also how would you like to differentiate from COPD and asthma? How would you like to differentiate from bronchiectasis with infective exacerbation of COPD? Then investigation in details, and then treatment. So this was station 1 respiratory. Then I moved to the abdomen. The patient was ictering. There was an oblique scar in the right iliac fossa, and patient also has had anemia and hepatosplenomegaly. So I just told about the clinical findings, then asked about the differentials. So I put chronic hemolytic anemia first, then asked about what are the clinical, chronic hemolytic anemia. Then I said about thalassemia, hereditary spherocytosis, and other diseases. And the questions was about investigations, very detailed investigations of almost all, then the treatment options. Then I moved to station 2. Actually, it was also a tricky one. It was a space occupying lesion. Most probably, patient came with headache for 6 months. She had a history of stroke and left-sided weakness. And when I entered the exam room, actually the surrogate was didn't understand any English. So whatever question I was asking, she repeatedly said the same things. So in 2, there was actually one help that she told me everything on her own, what actually positive in the history. So I didn't have, I didn't push that much. So, but the problem was that whatever question I was asking, she couldn't answer that. For example, I asked, how did it start? She said, in the morning. I said, did it appear suddenly and gradually? She again answered, in the morning. So I understood that actually she is not understanding, or she doesn't know what is the answer of the question. So I just followed my format of station 2. So after the conversation, mainly consultant asked, actually that examiner asked lots of questions, like if it is, what would you like to do first? Okay, CT scan, MRI, solitary, if you find any solitary lesion, what will be the diagnosis? If it is not solitary, what will be the diagnosis? How will you examine the patient? What is the findings? If these findings, if there is a papilledema, no solitary mass, what will be the diagnosis? In this way, he asked lots of questions. So I was a little bit puzzled during that time, whether I thought that he was not happy with my answers, because he repeatedly asked lots of questions. I actually didn't remember all at all. So last question was, how will you know whether it is a primary brain lesion or it is a metastatic one? Then I actually answered that, okay, I would like to do a CT scan of the chest and abdomen. Then he was quite happy. And before that, he asked actually lots of questions, like before this, how would you like to do anything? Whether there is any infection, how will you investigate this patient? How will you know that? So what will be the presentation? So I tried to answer so far I knew. So more or less, these are my exam experience in short.
Exam journey. Thank you, Dr. Naima.
Yeah.
Take a deep breath and
Yeah.
drink a cup of tea
Actually,
or warm water.
I'm a little bit sick for a few days. Actually, almost it's 1 month. It is not going away with me. I'm not sure what's wrong with that virus. I think it's adenovirus. I tried a lot of things, but actually it didn't help that much.
But
So,
I think not only virus, our journalists are also behind you, and there are many things behind you, not only virus. So Dr. Naima, thank you very much. I think we can extend a little more and take rest, and again, happiness. And what you say to us, in the meantime, may I request all other colleagues today, just keep your hand raising, doctor, to ask any important question in your mind to Dr. Naima. She will be happy to answer. The thing is that Happiness is not in the face, rather happiness in the mind. What examiner is showing to you may not be the real thing, and to test
Yeah,
you.
yeah,
And
yeah.
the last station, what you said is, this is the technique. The examiners are actually like a buffer here. As you
Okay.
could undo in the communication with the patient, examiner understood this is a technical problem is there, and they
Yeah,
know
yeah,
how to overcome the technical problem. A more
yeah.
experience in my life also when I was examining like before, not only the PACES, even in my OSCE exam for the MRCP. Anyway,
Okay,
I
okay.
think Dr. Sarfaraz Khan is here. He was also waiting. May I welcome Dr. Sarfaraz? Please, please, welcome. You can open your mic.
Hello, Assalamu alaikum to everyone.
Islam, please. May I
Um,
have your introduction, please? You are from?
my name is Dr. Sarfraz. I am from Pakistan, but now living in
Welcome.
UAE.
Welcome, doctor. Please, please.
Okay. My question is that what you guide to improve our communication station, and number two, what was the legal issue in that scenario of telephonic conversation?
I don't know,
Okay.
Dr. Naima will be here any input. Dr. Naima, please, can you respond?
Yeah, yeah. Okay. Actually, it's very difficult. Basically, to improve the communication skill, I think we have to practice a lot, and also it's better to understand the key point of the scenario. So actually, I'm not sure. I am not also that much good in communication as well, but I read the books All Rocks for several times, second edition, and also I just put some words from there, and rest of that I actually practice a lot. So that's actually I improved my communication, and more importantly, it's better to make a pattern of yourself, like how you are comfortable to speak. I think it's better not to memorize anything, especially for station 4, because whenever we try to memorize anything, it looks like fake. So it's better it needs to be spontaneous, and only we can do that if we can make a format of ourselves, like where you how you would like to talk, not you shouldn't
Okay.
follow others things. This is
Okay.
a small tips for improving the communication in station 4. Okay, and in telephone consultation, the legal issues was PALS mainly, because he wanted to complain, so I referred her to the PALS. So it was the legal issues here only, and also there was not that much other legal issues in my scenario. So I just only
Okay.
said about the PALS.
Yeah,
Okay.
thank you, Dr. Naima, Dr. Sarfaraz
Okay.
also.
Okay. Thank you.
May I have some input in this regard, doctor? If Dr. Naima thinks better, can I have some input here? For
Yeah,
the
sure, of
telephonic,
course.
because this is your time today, we told before already.
No, sir. Actually, I am
Dr.
very
Sarfaraz,
angry.
please. Yeah, Dr. Sarfaraz, be connected. Be connected.
Okay. Okay.
The thing is that actually it will take a little more time, but in short, as you asked about the ethical or legal issues are here. And number one will be the identification of the patient with whom you are talking about. The
Okay.
voice may be the same of the brother or sister of the patient. You don't know with whom you are talking because you are not looking.
Okay.
You are missing in the clinical context. If you say that you are missing the every clinical observation with your eyes when we see a patient in front of us, there is a lack of that. And another thing, if I just finish by saying one little story of the telephonic conversation, suppose you got a report to deliver to the wife of a person, the wife is the patient, and you have the report of HIV positive. What you have done, you just talk over telephone, but you're calling, you're not getting any patient there. Nobody is responding, but you have the memory system and you put the message over there in the memory. Okay. You expect that the patient will come and got the message as a stored memory. Unfortunately, husband came and opened the phone and got the message that her wife have HIV positive. Now you know what may be the consequence there. So there are many hazards and drawbacks of the telephonic conversation. I hope that the future, the PACES make a routine station of the telephonic conversation. So I feel actually very privileged in future to make an arrangement for the session for the telephonic conversation. On that day, if you get Dr. Naima also with us, it will be a very great day for us. Thank you very much, Dr. Naima and Dr. Sarfraz.
Actually, I had no idea about the telephone consultation because it was the first time I actually did this type of station 4. So it was actually most probably Allah's wish that I would pass, but I was really worried because of this station 4 actually, because I what I said I didn't know whether I said it right or wrong, or whether the examiner will take it or not. So it was really a challenging one for me, just to prepare within 5 minutes and talk for 14 minutes. It was a really challenging one.
The things are like that. Again, my humble comment is that when the station is very critical, difficult, examiners judge the station as such. They are not very, very difficult in giving the score there. This is the thing. So may we expect any other question from other colleague, please? Just better, can you raise hand and you can share? You have heard the story of Dr. Naima, the whole story. It will be actually a collection, great collection for us as well. Just again, to come back to the telephonic conversation, it is a regular common station in the MRCGP UK. I repeat the word MRCGP UK. For that, the candidates are well trained up, those who are working in the UK now as a MRCGP candidate. So no more hand raising. Better not to write any text, doctor, in the chat box, beloved colleague. We expect that you will ask verbally. Yeah, Dr. Tasneem, please welcome. May we have your introduction, please, in short, and from where you are, Dr. Tasneem?
Okay, I'm Dr. Tasneem from Bangladesh.
Welcome, doctor.
I
Please.
actually
Doctor.
want to ask.
Please.
Yeah, I want to congratulate Dr. Naima first.
Thank you so
I
much.
wanted to know, okay, how you take preparation. I think it was a long journey. It took possibly 7 years or 6 years to complete your MRCP. So how you take preparation and how you continue your study?
Dr.
Okay.
Naima, please.
Yeah, sure. Actually, I started to prepare my MRCP PACES exam since 2019, almost around March, June or July. Okay, but during that time, actually, it was really difficult to start the preparation because there was not that much books, well-oriented books for me. But I actually followed one book I'd like to share, that Sonam Kapuri's Station 2 and 5. So when I found that book, it was a little bit easy for me to practice Station 5 mainly. And actually, I saw lots of patients. During that time, I didn't have any baby. So I just spent almost from 9 to 10 a.m. to 8 to 9 p.m. in the hospital. And in BSMMU, in NICBD, NIDCH, Dhaka Medical College Hospital. So actually, I spent a lot of time beside the patients. So it helps me to improve my clinical sector actually. And also, excuse me, sorry. And also, I studied actually Rupa Vasant mainly for Station 1 and 3. OST, and also Station 2, Gautam Mehta OST. So these books were very helpful during that time, as well as I did some online course during that time. So they also helped me a bit to prepare myself. And also I had some very good partner during that time. So overall, actually, my main preparation was during that time. But this time, actually, I didn't get that much time to prepare myself. And there was a very big gap of clinical practice because of COVID. So, but this time, what I did actually, I only saw the good quality of patients, the patients which usually came in the PACES examination. So, and also I actually, what I did, one thing that I solved the Red Golden Guide. So it actually helped me a bit to think a variety of it helped me to understand the which type of patient usually PACES or Royal College gave. So thus I actually overall you can say prepared myself. And actually I think to get a good mark you have to be very sound in clinical sector. Like station 1 and 3 has to be very sound. You have to be very sound in station 1 and 3. Otherwise actually it's difficult to pass the exam. But if you are going to if you are planning to go to UK, then I would suggest that definitely you have to be very much good in station 2 and station 4, because they are very picky in station 2 and station 4. And I'm not sure they are very concerned about that. So if you are going to appear in the India, then I will tell you that you have to work on station 1, 3, and 5. Then you will definitely pass. But if you are going to go to UK, then you have to be very good in station 2 and station 4. So actually I appeared once in UK and another one in India. So I found the differences in these two sector actually.
Yeah, Dr. Naima, thank you. I have
Okay,
Dr. Tanne, you got your answer.
Thank you so much.
Yeah. So expecting more question from others, and we're appreciating you, Dr. Naima, for your spontaneous statement that you couldn't pass earlier. And it remind me that the traditional proverb, failure is the pillar of success. I think you know
Yeah.
about that.
No,
And
actually,
the MRCP PACES is like that, really. So
yeah.
those who couldn't pass in the first time, we hope that nothing there to be frustrated. And whenever you're appearing more exam, you're gaining a lot more and more. So there may be many reasons that you struggle hard with your baby also in the course of preparation. And the last 2-3 years, really, a lot of problems you are facing due to the COVID situations. Many things actually disturbing too much. That's all.
Yeah.
So any other thing, any other issues from our colleague? Or I hope you all are satisfied from our talk today. In the meantime, I shared our links to you in the chat box you can find in the Zoom for our regular update and others. Those who are not connected with us, you can join there, please. I just posted the links in the chat box of Zoom. You can click there and join. Okay. Now
Hello,
we got
Dr.
Dr. Raiza. Dr. Raiza, please. Dr. Fairuz Raiza, please.
Hello, Assalamu alaikum.
Walaikum assalam.
Hello, Apu. I'm Raisa. I have met you once or
You're
twice.
from, please. You're from.
I'm in Bangladesh. I have passed from Holy
Please.
Family Red Crescent Medical College
Okay,
Hospital.
okay.
So, Apu, many congratulations to you.
Thank you so much.
And I have listened to your whole stations, and it's very inspiring for us who are planning to sit for PACES soon. So, Apu, my question to you would be, which material did you think worked best for you in terms of the crossing part?
Okay, actually, in crossing part, I mainly read Rupa Vasan for station 1 and 3. Actually, it's written very well. Also, I read Gautam Mehta OST in my last preparation. So, mainly these two books are, I think, enough to answer the questions in station 1 and 3. And regarding station 5, actually, I just read about the Sonam first, just to understand how I should approach and what should be the examination part and what should be the concern. And after that, I just solved the OST station 5 as well. So most probably these are the things I studied. These are the books, and also the second edition of All Rocks helped me a lot just to improve the station 4. Second edition, not the first edition, because in the first edition the scenarios were very little, and there were most probably only 11 to 12. But this edition, there were 40 cases. If you solve the 40 cases properly, I think it's more than enough, and you will get an idea how you should approach. What should be your approach? So, but again, what I have already told that what I found that I didn't memorize anything. I made my own pattern. So it helped me a lot because the station 4 was totally unknown to me, but I just follow my format. I just did the follow my format. How should I say and what should be the approach? And I think it helped a lot because I didn't have any idea about telephone consultation. Still now I don't have that much idea. The sir knows better than me a lot, but just to follow the pattern, it helped me a lot.
Yes,
And
Okay,
that's
Apu,
one
thank
more
you so
tip,
much.
yeah.
tips I'd like to tell that it's really important to keep calm during the examination. During the exam, it's really important to keep calm. Otherwise, actually, it's very difficult to pass. I just kept calm during that time, even after getting this type of bizarre scenario. So
Yeah.
that's the important thing, I think.
Thank you,
Okay,
Dr.
Apu, thank you
Naima
so
and
much.
Dr.
You're
Fairuz
most
also.
welcome.
Yeah. I found another colleague raised the hand. I think you got your answer as well. Dr. Patel, I found here. I don't know. So feel free and ask Dr. Naima, because this is the chance for you. Again, we are grateful to Dr. Naima to be with us. Anyway, if no more, I think we are at the end, and may I request now Dr. Rashid
Hello.
Islam. Sorry, someone again?
Hey,
Please.
I'm Dr. Faisal from Bangladesh.
Please welcome Dr. Faisal.
Naima, Dr. Naima, I just asked you a question regarding your abdomen case. You said they asked lots of questions about investigation. Could you please tell me little bit details?
Yeah, sure. They first asked about how would you like to investigate for thalassemia. Then I answered. Then they asked if it's a case of myeloproliferative or lymphoproliferative disorder. Then how would you like to examine? How would you like to investigate this patient? Then I answered the question. Then the question was how would you like to investigate about chronic calajor, chronic malaria? Then I answered. Then the question was if the patient had CLD, then how would you like to know about the prognosis of the condition? But what investigation you would like to do? So I first I told lots of things like bilirubin, SGPT, and blah blah blah. But he was not that much happy. Then I understand what he wanted to hear. So when I said that about prothrombin time and serum bilirubin, serum albumin, so then he was happy. So and also about what findings you will get about on ultrasonogram, and what peripheral blood film, what will be the features, and also electrophoresis, what will be the features. So these are the main questions he asked. So far I can remember right now.
Thank you, Doctor, and as
Thank
well
you.
Dr. Faisal. Anyone more, please? You cannot raise. You can directly open the mic and ask the question. No more? Okay. May I request now Dr. Rashid Islam, please, our very sincere and I think definitely brilliant mentor. And Dr. Naima was long time with him as well. Dr. Rashid Islam, please.
Okay, first of all, thanks and congratulate Dr. Naima. And
Thank you
also
very much.
thanks to other participants to present here. And actually, I saw Naima in the bedside, and actually she was so much brilliant. And at times I also noticed that she will do something good in the exam. And actually, this has happened also in that way. So really congratulate Dr. Naima.
Thank you, Bhaiya.
And hopefully other candidate actually also inshallah will pass. There are a lot of candidates actually gave exam this diet. And also just thanks to other candidate who will not who will appear soonly in the diet 2 or diet 3. And actually every candidate has some different preparation technique, but I'm actually just says how she got his preparation. That's good. And I think that someone need to actually take some follow about that, who are actually newcomer and also who will who take the preparation recently. I think then that will be actually just help to everyone to get this sort of preparations. Thank you, Dr. Naima, and again congratulate Dr. Naima.
Thank you,
Thank you
Dr.
so much,
Rashid.
Bhaiya.
Thank you, Dr. Rashid. So I think within 1-2 minutes we can conclude. What I was thinking for Dr. Naima, as Dr. Naima said that you have your own preparation way that I appreciate. And if I remember, it was the same thing happened to me. And I was not also that much prepared for the exam. But I prepared myself. I developed my one as a very, very unique to me. And that was very good for me. And I passed my PACES in the first time. So this is the one thing. Second thing is that I think those who are colleagues are here may be appearing in the diet 2, but you know that from the diet 3 there will be a little modification of the stations. It will be said as PACES 2023. Previously it was PACES 2020. Unfortunately, for the COVID situation, was not executed. So those who are very recently passed part 2 written and thinking to appear minimum after 1 year, I think you will be oriented for the PACES 2023. And for your kind information, very soon, within few days, I think we will notify you and give the message to you to join to an orientation program from DOAMS. Definitely, Dr. Rashid will be there, and I will try my best to attend the session by myself. So with the few things, if Dr. Naima have any last sentence from you to the colleagues, then we can conclude, Dr. Naima. Tasneem, please.
At first, thank you so much, everyone, for congratulating me. And actually, it was really a pleasure to have a conversation with all of you. I'm not sure how much you got from my conversation, but I hope that I tried a bit to help you guys. And in future, who are in Bangladesh as well as in abroad, if you guys need any kind of help, you can feel free to knock me. I will try my best to help you. So far, I know my knowledge is not that much actually, so I'm also still learning. So please, everyone, keep me in your prayers, especially for me and my daughter and my whole family. And also pray for me that I can be a very good physician. I just don't want to have a good score. I also want to be a good physician. So that's my main motto. So I hope everyone will pray for me. And thank you so much for everything. Okay,
Definitely,
sir, that's
Dr.
all.
Naima, we are praying the best for your next journey of your life.
Yeah.
And finally, with the gratitude again, we'd like to conclude by inviting all of you to our regular Friday session, maybe in the Ramadan. It a little bit, we're getting a break. And preferably around this time, Dr. Rashid was taking the classes for a long time. It's very free for everyone. Anytime you can join with us in the group and we'll be informed in time. With a few words and again, showing our gratitude to all of you, we'd like to conclude here. Thank you very much. Thank you very much.
Thank you, sir.
Best of luck.
Thank you. Thank you, Doctor. Okay.